Hello and welcome to Fit News. I'm your host, Jen Shaver, and joining me today, I have a very special guest, Dr. Katie Harris. After playing 4 years of soccer at Heidelberg University and graduating with an athletic training degree, Dr. Katie Harris moved out to St. Louis to start her education in chiropractic care. Upon graduating from Logan College of Chiropractic in early 2015, Dr. Harris settled into her new home in Worthington, Ohio by the fall of 2015. With an extensive personal history of knee and low back pain, Dr. Harris strives to provide excellent chiropractic care to patients of all ages. Dr. Harris's hobbies include anything outdoors and, of course, spending time with her son, Will, along with her 2 rescue dogs. Dr. Harris, thank you so much for taking the time today to join us to chat, because I know that for many, chiropractic care, there's a lot of myths surrounding it, right?
Yep,
I mean, there's a
absolutely.
lot of stuff that you hear out there about it. So I want to take some time today to kind of clear up some of those main
Sure.
myths that are out there. Where do you want to start with those myths? Which myth?
Yeah. I think one of my favorite myths is that people don't consider us real doctors, however you want to
Right. Air
say
quotes,
that.
right?
So, yeah, right. So, with that being said, a lot of people ask about our background or education. So, it
Mhm.
is still a doctorate. That's why we can call ourselves physicians and doctors. So, technically, our degree is a chiropractic physician. So, I
Okay.
still have a license with the state board. We still go to technically med school. We just already know what we want to do. So we don't
Mhm.
have to do the whole residency, attend, that whole
Right.
gambit, because we already know we're going to be doctors of the spine or doctors of the nervous system. So
Mhm.
we don't have to do all that stuff. So when someone comes to me, I think my favorite story was there is actually a pharmacist looked at me and said, I just don't understand how chiropractors can call themselves doctors when they only have an associate's degree.
Oh,
And I was like, oh, okay, well, let me just educate you real fast.
yeah.
Still went to med school, still went to, 8+ years of schooling with undergraduate degree.
Right.
So, just it's always fun when people say that we're not real doctors, because we still have the schooling, we still have
Mhm.
all of the things. I still had to learn how to draw blood and do abdominal exams and do OBGYN exams, just like any other physician, MD, or anything that goes to medical school. So that's always my favorite to share with
Yeah.
people who think I
Yeah.
just have an associate's degree.
Right. Oh my.
Yeah, and my patients would beg to differ. So
Yes. Oh, I'm sure. Yes.
yeah.
Yes.
So there's always a ton that go, with chiropractic. A lot of people think that if you don't hear a pop, then something didn't adjust. So when we are working with the spine and we are doing what's called a chiropractic adjustment, we
Hmm.
are working with the spine and putting it back into an alignment that it's supposed to be in. So your spine
Right.
is supposed to be in a certain position. We evaluate and see that it's not in that proper position. And so we do chiropractic adjustments to put that back into the right position. And patients think, oh, it didn't pop, so it must not have adjusted. Well, that's not how that works either. So when we are with patients, a lot of people think also that we have to, twist them and bend them and manipulate them in, very forceful ways, and we don't have to.
Right.
There are dozens of different techniques that chiropractors could do. I see anyone from the age of, I think my youngest patient in the office was 3 days old. Obviously, I adjusted my son the day he was born. But 3 days old up until I have patients in their 90s.
Wow.
Obviously, I'm not going to, twist and pretzel them like I do to some people. But you don't have to hear the pop. You still can get a chiropractic adjustment on someone if it is just moving slightly. It does not have to cavitate. That's what that popping sensation is. And a lot of people think also that we're breaking something if they hear that. That's also not true. That when you hear it, it's called a cavitation, which nitrogen gas naturally builds up around a joint when it's not moving properly. Just like you can, pop your knuckles, it's the same concept. After that was, debunked after a while, right? Because all you're doing is releasing gas that was in that joint space. So when you add proper motion to the joint space with the adjustment, it releases the gas. So that's always one of my fun ones. And my little kiddos that I see always like to say, so it's like my back is farting. I'm like, sure, if that's what you
That's a good one.
if that's what you want to say, and that makes you feel better, but you go tell your friends that, that's fine. Kids are the funniest when you get them adjusted. They
Oh
love it.
yeah.
So yeah.
Yeah.
Um, the last one is, I think that I always like to hit is a lot of people think that you have to go to a chiropractor forever.
Mhm.
I think I get that a lot. I don't want to start with a chiropractor because then I have to keep going.
Yeah.
And I always like to use the dental analogy for this. You don't have to. You can come to me when you're in pain, and you can come back to me when your pain comes back, because it will probably come back. But chiropractic care is a lot like the dentist or going to the gym. If you go once, and I think your clients will attest to this, you're going to feel great, and then it's not going to last very long. Chiropractic care is the same way. So yes, you could come. We have patients. We're a wellness practice here. So we have patients that have been coming to us for the 37 years that the practice, has basically been open.
Yeah.
So it just depends on your philosophy and what you want to do. You go to your dentist twice a year to check up on your teeth.
Yeah.
Chiropractic care, you got to check up on your spine a little more than twice a year, but you can do it twice a year if you want. It's
Yeah.
kind of the same concept. Eventually, once we get you out of pain and we get you functioning and feeling better, then it's about maintaining that. And that's a lot like, when you're going to the gym as well. You want
Hmm.
to maintain feeling that way. So you want to keep going to the gym, right? So
Yeah.
same kind of concept. So no, you don't have to come forever, but we will recommend it as a wellness practice just to make sure that you're living the best life that you possibly can.
Right,
So,
right. And
yeah,
I'll tell you, as the dentist's wife, I can identify with all you just said.
there you go. You got to get those teeth checked. It's the same thing. And I always tell people all the time too. It's funny. People are always like, "Well, how come I don't feel that?" Or I tell them something is wrong in their body, and they're like, "Well, I don't have pain there." I'm like, "Well, you don't have to have pain. Pain is actually the last thing that shows up." So it's a
Right.
lot like your teeth, right?
Hmm.
Well, I didn't know I had a cavity there. Well, yeah, most people don't know that they
Right.
have cavities, but there's
Right.
still a problem. Same
Right.
thing with your back or your spine. You
Right.
want to make sure that you get it checked frequently so that
Uh-huh.
we don't have a problem.
Right.
Those
Right.
patients that come in that are like, all I did was bend over to tie my shoe. I'm like, well, this has been building up for a while, and that was the last thing that, for better words, broke your back. So
Right.
we want to
Broke the
make
camel's
sure.
back.
Yeah, exactly. So we want to make sure that we take care of it and maintain it, just like you do your teeth with the
Right.
brushing of your teeth and going to the dentist. Yeah, very,
Right.
very similar thing.
Yeah.
Yep.
Preventative, right?
Yes,
Preventative caring,
absolutely. A
catching
lot of
things.
what we do is
Yeah.
preventative. Yeah, we're very good at getting rid of people's pain. That's what we're known for.
Right.
People come to us that can barely walk because they're in so much pain. They have headaches that they just can't manage. Things along
Yeah.
those lines are very popular reasons why people see us. But the preventative aspect of chiropractic care, I think, is where a lot of people don't necessarily realize how beneficial it can be.
Hmm. Hmm. Well, and it's like you said, with the cavity analogy, because, if you catch it when it's small, right,
Yeah,
then we can
right.
just
We can make a big
do
change. Yep.
do a little
Yeah.
change. We can just put a little
Yep.
filling in there. But
Yep.
if we don't catch it because we didn't go to the dentist, now suddenly we risk either losing the tooth completely, right?
Yep.
Or
Right.
a more expensive procedure, a root canal or a crown
Exactly.
or both, or
Exactly.
your problem just gets worse. So
Yep, it just builds and builds and builds. Yep.
yeah, yeah.
Absolutely.
So
Absolutely. So those are always
preventative.
my favorite myths. Yeah.
Yeah. And I think those are probably some of the most common that
Yep.
many can
Yes,
relate to
ma'am.
hearing and
Absolutely.
understanding. And maybe some that people believe that are listening, like, oh, I
Yeah,
didn't know that. And it's
absolutely.
good to know that that's what's going on.
Yeah,
Um,
absolutely.
so I know that you mentioned that you played soccer for 4
Yeah.
years at a collegiate level, and that you also suffered from a lot of knee and back pain. Is that kind of what led you down this road to chiropractic,
Yeah.
being a
Yeah.
chiropractor,
So
or?
I played all the way. I played since I was 6 years old.
Wow.
I didn't stop playing until I had my son a little over 2 years ago,
Mhm.
or I guess I should say it when I conceived my son. I stopped playing. So I've always been active. Love, love, love the game. And when I was 15 years old, I started having pretty significant knee pain.
Yeah.
And come to find out at the time, I grew about 6 inches in like half a year. So
Wow.
it was a very big growth spurt. And my physician at the time thought, you just overstretched everything. We did everything. We did the PT, we did the braces, we did the strengthening, we did all of it.
Hmm.
And none of it seemed to help. my tracking issues with my kneecap or my patella. So I had my first surgery at 15, second surgery at 16, and at 19, I was dealing with a residual injury. After I had the first two knee surgeries, I ended up my senior year of high school almost blowing my knee out completely after doing all that work.
Wow.
And I said, no more surgeries. So I just rehabbed it and I was doing okay. But playing college ball at 19, my knee got stuck again. And earlier that summer, I actually hurt my low back training for college ball doing a back squat. Thought I was stronger than I was and lost a little bit of my form, which is very important on that one,
Yeah,
and tweaked
which
my
could
back.
probably be attributed to the knee. I would, the
Correct,
weakness in the
correct.
knee.
Yep, it's
Yeah,
all connected, and I didn't
yeah,
realize this until
yeah,
I was a
right.
little older, right? And
Yeah.
I was in chiropractic school and realizing like, oh, I probably could have fixed my knees by fixing my back. When I
Mm-hmm.
was in school to be an athletic trainer, I was, just very interested in athletes and injuries, obviously with
Right.
myself, knees had always become, but I wasn't looking at the big picture. And
Mm-hmm.
luckily, one of my rotations could be that I went and shadowed a chiropractor and also worked in the PT side of their clinic to see like a different aspect of where chiropractors, or sorry, athletic trainers can work in PT clinics. And the chiropractor was like, hey, let's just evaluate you. You're here. You might as
Mm-hmm.
well, like pro bono, let me just teach you some things. And I said, okay. Like, he's like, do you have back pain? I was like, well, yeah, but doesn't everyone? And I was 19,
Yeah,
I shouldn't have back pain.
right.
And he evaluated me, treated me. My back had never felt better. My knees had never felt better. And I was spending all this time and energy in the athletic to make my back feel better because it was more and more progressive. It was happening every couple months, then it was happening every month, and then it was
Mm-hmm.
happening every other week. And it was detrimental to me playing in college.
Right.
And I was also, I grew up medical model. My mom is an LPN. So, you had a sniffle, you took an antibiotic, make sure you didn't get an infection. You had this pain, you just take some Motrin, you'll be fine.
Yeah.
Um, but as I was progressing, it just kept getting worse and worse. So, all it was like, take more ibuprofen, take this pain
Oh,
medication, take
yeah.
this. And luckily, that chiropractor was like, we just need to do this. And it
Mm-hmm.
almost within 3, 4 visits fixed me. I was playing
Wow.
better than I had ever played. He showed me how, 20 some years of kicking a ball the same way
Yeah.
really, kind of twerked and messed with my pelvis. So
Mm-hmm.
fixing that fixed my knees, fixed how I was kicking, fixed everything.
Right.
So as I started learning about it, I was like, well, I don't want to be an athletic trainer anymore. I want to be a chiropractor.
Yeah.
So I, decided had no intentions of going to med school, had no intentions of going to grad school. I was just going to do my 4 years and be an athletic trainer. And that's the track, shipped out myself out to St. Louis, and I never look back. I love what I
Right.
do. Young athletes are a little niche of mine.
Mm-hmm.
I always tell myself I wish when I was playing year-round ball, that someone would have told me about a chiropractor to help prevent injuries and maintain and make me a better athlete.
Right.
And my mom was always, she loves it now. I got my whole family going to a chiropractor. They're in Cincinnati and I'm in Columbus, but they all have their own chiropractor now. But it's funny. She's like, I'm sorry I didn't know about it. I said it's okay. It's
Yeah.
all about education. But
Right.
now it allows me to still do I do more powerlifting type workouts. I can
Right.
still do that 5 to 6 days a week and lift a lot of heavy weight, and I
Yeah.
don't have any knee problems. I can run with my son. I can, pick him up. I can do all those things, and my back and my knees do just fine.
Yeah.
And all of that's because I learned how to take care of it through chiropractic care and wellness. So I always tell my young athletes that walk into my office and they're like, "Ah," basically like, I don't want to be here. I'm like, your parents are doing you a service
Right.
because as you are putting your body, you're not going to have pain.
Right.
But as you're putting your body through all of this stress, you want to maintain it and you want to make sure you're not wearing one side out versus the other like I
Mm-hmm.
did. You
Right.
want to make sure that your hips are level that way, that your knees are working the same, your ankles and your hips and your back, all of it's working together rather than one hip's higher than the other. So now you're
Mm-hmm.
wearing out that low side
Right.
faster. That's why a lot of people only have like one hip they need replaced when they're older and
Right.
one knee that they need because they're wearing one side out because they're not in balance and their pelvis and everything is out of alignment. So
Yeah.
yeah,
Yeah.
yeah.
I want to talk about that because a lot of midlife women, they do suffer with whether it's knee pain or back pain or hip pain. All of those seem to be a big complaint for,
I apologize for the phone.
the midlife woman. What would you say to her in terms of, because you don't have to be an athlete, right, to go to the
Right.
chiropractor.
You don't.
Yeah.
Like
Yeah.
I said earlier, my youngest is 3 days old and my oldest is in their 90s. So,
Yeah.
as far as patient base. So, no, I feel like actually a lot of my patients are right in that category.
Hmm.
They are, the parent that wants to stay in shape for their kids. They
Right.
used to be an athlete or not. They're going to the gym more. They're trying to stay healthy. They're trying to lose
Hmm.
weight. Those are most of the people that I see. And yes, some of them try to do something they shouldn't and they hurt themselves, and that's what brings them into the office. But I have people that walk into my office that are like, I just know that this needs to be part of my program.
Hmm.
I'm, moving a lot more, I'm doing a lot more, and I know my joints need the support. And that's
Yeah.
absolutely right. So as you're going through and you're exercising or you're just trying to keep up with your kids, right? Because
Hmm.
they're always moving, they're always doing something. You want to make sure that you take care of yourself, and so that
Right.
you don't need that knee replacement
Yes.
later in life, or hip replacement later in life. You can still do the things that you want to do.
Hmm.
I have patients that walk into me that have a pretty severe condition in their back, and they're still doing CrossFit, they're still powerlifting, they're still doing these things because we maintain it with their adjustments. So
Right.
it's not necessarily that you have to be an athlete. You do not, absolutely not. You don't even have to be going to the gym or anything. A lot of people this day and age sit for a living. And
Yeah.
that is one thing I am very thankful that I do not do.
Yeah.
I love that my job requires me to be on my feet. I hate if I have a day where I have to, do a bunch of
Right.
notes and charting and I
Yeah.
have to sit for a while. It's not my cup of tea. Sitting is ruining our back slowly too.
Uh-huh.
It's the most pressure on our spine. So we want to make sure that we, not only say, yes, should we be exercising? Absolutely. Everyone should have some sort, even if it's just walking,
Right.
some sort of exercise regimen. But even if you aren't, you're still a prime candidate for chiropractic care because you're still having stress on your spine. And
Hmm.
that stress is sitting for long periods of time. Those are those little things
Yeah.
we talked about, the last straw that broke the camel's back.
Right.
Sitting for prolonged periods of time, especially if you're not sitting with great posture. A lot of people over
Right.
COVID sat at their kitchen tables. I can't
Yeah.
tell you how many people I started seeing because they were sitting at their kitchen table and they're like, I don't know why my back hurts all the time now. I'm like, because you're sitting at your kitchen table. You're not sitting at a desk that's ergonomically proper for you.
Right.
So that bad posture is adding up, and eventually your back's going to say, I can't do this anymore.
Right. Right.
So, but especially the people who are into a great fitness regimen, you're putting your body under a lot of great stress. That is a good stressor. You want to be
Hmm.
doing those exercise programs, but you also want to make sure that you don't hurt yourself. And that is where I come in.
Hmm.
Looking and evaluating the spine. We always take about an hour of your time on your first visit in our office, making sure that we look at everything, taking x-rays, looking at what's going on, making recommendations based on that. That's why I have a therapy assistant in my office who's teaching you exercises, more like a little bit of physical therapy to make sure
Right.
that you're doing those at home. For my big athletes, we see a lot of athletes. We see some OSU athletes, things like that. We want to make sure that they're using kind of those exercises that we show them as like warm ups or cool
Right.
downs,
Right. Because it does,
to
it's
go
not
with.
just that time in the office with you. It's what it's,
Correct.
that's important, but it's what you do
Yep.
with the
It's
rest of your
educating
day.
them.
Just
Yep.
right. Right. I mean, it's just like your exercise. You just because you did a workout in the morning doesn't mean the rest of
Yeah.
the day you sit in your chair. Right.
Yeah,
It's what you
exactly.
do with the majority of your time. And
Yeah.
so, yeah,
Hmm.
using
Absolutely.
what you teach them
100%.
is
Yeah.
important.
And yeah. And for, middle-aged parents, it's important to show your kids, right? So
Right.
you want to make sure that they grow up knowing that there is an option for them that's, holistic, non-medical to help with aches and pains rather than, and that's just a good thing. And if they're staying active, then their kids will most likely be active,
Hmm.
just is a nice leading by example demonstration. So
Right. Right.
yeah.
I know many people probably wouldn't think of it like this way, but you were talking about, sitting at your kitchen table and,
Mhm.
having pain. It needs to be thought of as an overuse injury because that's really what it
Correct.
is. it's an
Correct. It
overuse
is.
injury. We think overuse injury, from running, or overuse injury
Mm-hmm.
from doing some
Mm-hmm.
sport. It doesn't have
Right.
to be a sport. If you are sitting in improper position for an extended period of time in your car, at your kitchen table, wherever
Exactly.
it is, that's an overuse
Exactly.
injury.
It is. It is. Absolutely. It's so common these days too, just
Right,
because people do. I mean, for the first time in our since humans have been a thing, we have never sat like this.
right,
Um, you know, before cars were a thing, you always walked everywhere. Our
yep,
bodies are designed to walk 13 miles a day.
right,
That is what we were designed to do. And even the people that are exercising probably don't even get 13 miles in a day.
right,
So I always tell people, people always like, oh, you're going to tell me to join a gym and do all. I'm like, no, I'm going to tell you to start walking.
right. Just
Just like
move.
you talk about your dog, walk your dog at lunch. Like it doesn't take you an hour to eat.
Right.
Get off your phone, don't watch your
Hmm.
show, take your dog for a walk. Like even
Right.
if you're working from home and when you talk about the overuse, it's absolutely correct. I always break down physical stress in people's life into macros and micro. So
Hmm.
macro is those big accidents, the car accidents, the falls, the traumas, the things that
Right.
people always think to go to a chiropractor for. But the
Hmm.
micro is actually what's absolutely more detrimental, and that's an
Right.
overuse. Yeah, your bad posture when you sit, your bad sleeping habits. Are you a
Yes.
stomach sleeper versus a back sleeper? Back is the best way to sleep, and a lot of people are very uncomfortable sleeping on their backs, and a lot of times that's because they need their pelvis adjusted. But if they put a pillow under their knees, that will help. If they need to sleep on their side, they need to sleep with their knees together with a pillow in between, not
Mhm.
bring one up and turn over. That's one
Right.
third of our life. So that's
Right.
also an overuse injury if you're sleeping in an improper way. And
Yeah.
those are the types of things that I try to educate because, yeah,
Hmm.
they're only in my office for 10 to 15 minutes at a time. And, what you're doing at home is probably what's actually causing the problem. So,
Right. Right. I
yeah.
love that you just brought up the sleep positions, because I think that you are correct. A lot of people aren't thinking about that. And when you think about how much time you spend, you
Yeah.
know, in a whole week,
One
right?
third,
Thinking
one third of your life.
that's a
Sleeping
lot.
is one third of your life.
So,
Yeah. So when someone comes to my office and they're like, God, you're doing great, doc. I'm doing great. But it just still really bothers me in the morning. On my intake questionnaire, it asks the patient how old their mattress is.
wow.
People always like, why do you ask that? I'm like, well, because if your mattress isn't supporting you for one third of your life, it's
Yeah.
going to cause back problems or neck problems or shoulder problems or anything, depending on how you sleep.
Yeah.
So if we're not getting better with care and you're still reporting that first thing in the morning you still don't feel good,
Uh-huh.
then I'm going to recommend that we buy a new mattress. So
Okay.
people
All
are
right.
always like, that's a weird question. I'm
I
like,
love that though,
it's
because I think that really shows that, it goes much deeper.
Yeah. Well,
Yeah.
we could be those people that just, adjust you and send you on your way and you keep coming back when you're in pain, but I'd rather not see you. I'd rather,
Yeah.
space your appointments out. You only have to
Right.
come in every couple weeks.
Hmm.
If you're making those changes at home, then I don't need to see you. If your spine looks good,
Yeah.
if we're maintaining that, then we're doing pretty good. And that's not based on just pain. That's just based on how they feel.
Right.
Because when we're working with the nervous system, we're impacting everything. We're impacting the brain. We're impacting your digestive system. We're impacting your sleeping habits. All of it's connected. So
Hmm.
when I have patients coming and being like, "Hey, I'm more regular in the bathroom," I'm like, "You're welcome." Or,
Yeah.
"I'm sleeping better. I'm sleeping more soundly at night. I'm not, turning and tossing." And they're like, could be because I started this? I'm like, absolutely. And
Yeah.
a great researcher out of New Zealand and Australia, Heidi Havoc, is now able to prove it. We've been saying it since we've been around, and for 130 years ish now, I think chiropractors have been a profession. But she's proving with science now that when you get an adjustment
Hmm.
for at least 20 minutes, your brain is positively impacted. And that, connection between your brain and your body and your body and your brain is
Yeah.
almost 100% clear. It's realizing, oh, I didn't know there was a problem here, and the body is like, we were trying to tell you, but we just couldn't because
Yeah.
the spine wasn't aligned properly. So all that research is just wonderful to just help people realize that, yeah, we're really good at pain, and getting rid of it, and headaches and things like that. But chiropractic care is a little bit bigger than that.
Right, right. I want to go back to the mattress thing because I
Yeah,
know people are probably thinking, she was talking about mattress. Is there a type that you recommend then? Because I know
yeah,
that's going to
there
be a
is.
lot of minds, like once they heard the
Yeah,
mattress, oh no, and they
yeah,
start thinking, gosh, mine is this old, or, you know,
yeah,
what should I do?
yeah.
But what do you recommend they
Yeah,
get?
so I mean, normally people, after 8 to 10 years, I think is what they normally try to tell you for a traditional spring, mattress or whatever.
Hmm.
I actually steer people towards a purple mattress. The
Okay.
company Purple, it is research wise shows the best support on your back.
Hmm.
They also last longer.
Okay.
So yes, you're going to pay a little bit more, but
Hmm.
that mattress is going to support you the best and it's going to last the longest. I think they still have a 10-year warranty. So that just shows you
Hmm.
that mattress lasts longer. I have owned mine for 5+ years now. My partner is not a small person, as far as like 6'6" and athletic build. So, and his side of the bed is not even closely worn down.
Yeah.
So it is the most comfortable bed I've ever laid on. I would have a little bit, coming out of chiropractic school, you don't make that much money. So I had a cheaper mattress. And as you realize that it is detrimental to your health as you are coming to work and you're tired because you were tossing and turning all night and your back even hurt a little bit in the morning, you have to do what you preach, right?
Right.
So I got the mattress and I've never looked back. And
Yeah.
to any patient I've recommended it to that have actually purchased it,
Hmm.
I have not heard a complaint.
Yeah.
Um,
Okay.
so it's always the one I go to. IntelliBed is also another one.
Oh.
They are basically the same patent, the same design with the
Oh.
honeycomb gel so that's also one if people don't want to do the purple. But
Hmm.
I try to steer people away from Tempur-Pedics, things along those
Okay.
lines. That tends to just make it worse for a lot of people. Purple
Interesting.
does also have, and I'm not I don't make money saying,
Right. No, yeah.
recommending a purple. Absolutely
Right.
not.
Right. Yeah. Not,
They
this
don't
is
do
not
that.
a paid
Yeah,
endorsement.
exactly. They don't do that. But they have different firmness. So
Yeah.
depending on what you like. So if I have a patient that's like, well, I really like it firm, I'm like, okay, then you need to get what I got. And I got a firm one, and that's this one, which is like the
Mm-hmm.
level 2. If you want to still feel like you're sleeping on a cloud, then you want to go to like the level 4 or something like
Hmm.
that, which has a bigger gel thing, so it
Ah,
makes you feel like it's squishier.
ah,
I'm not a
ah.
squishy bed person. I like the feel of a firm bed.
Right.
So I went with the level 2, which is a little
Yeah.
firmer mattress. So yeah, that is the one that I do recommend to patients.
All right.
And like I said, so far everyone has really enjoyed it. So
Good. Well, good to know. And I'm sure that's appreciated by my listeners.
yeah,
You
absolutely.
also mentioned everything's connected. And I want to talk about that um, in terms of our alignment with our body, because we know that, if I'm having trouble with my knee, it's not necessarily the knee
Yeah, yeah.
that is
I
the
just had,
problem, right?
yeah, I just had a
So,
young cross country runner this morning
yeah.
that she's about to, cross country's in the fall, so she's about
Hmm.
to start that up, and she's like, I went on this 30-day camping trip thing, which was great, but my knee started bothering me, and now I'm like scared to run. And oh, I said, okay, well, let me take a look at it. And it's just muscles.
Hmm.
So, and it's because her hips are so
Yep.
misaligned that her muscle is pulling oddly and it's inserted at the knee, and therefore then the knee is going to start hardening. It's the
Yep.
same thing with the IT band. A lot of runners have
Yeah.
this. It's called runner's knee, right?
Yep.
So on the outside of their knee, they start experiencing pain, and they're like, "Oh no, I tore something, or my meniscus, or
Right.
cartilage, or I'm wearing and tearing it," right? And I look at him, I'm like, you gotta get these IT bands under control, which is coming from the hips. So yeah, a lot of knee and ankle problems
Hmm.
actually stem from the pelvis and the low back
Hmm.
not being in the proper alignment. So you want to make sure that you look at those. I mean, the number one thing I look at with all my runners. We have a lot of marathon runners as patients,
Yeah.
a lot of young athletes as well, like runners, track runners, cross country runners. So you want to make sure that you take a look at the hips, which are
Hmm.
connected to to the knees via all of that stuff.
Yeah.
And I mean, they always look at me like I'm crazy when I'm like, I'm actually going to work on this part of your hip. It's going to
Uh-huh.
make your knee feel better.
Right. Right.
In a more kind of drastic example, when you're working with just the spine, I have an older woman who had really bad scoliosis. It runs in her family. I actually see both of her adult daughters as well for their
Mhm.
scoliosis to manage it. But she didn't know about it soon enough. And so she has had two rod surgeries in her spine,
Wow.
and hers was so severe. So she came to me and she's like, I can't. I have so much low back pain. I just don't want another surgery. And I said, okay, well, let me take a look at your films. Another reason why we need to take films. And I noticed that her rods were actually fused to her SI joints, like they had fused them. And I said, I can't move anything. Everything is, in your low back,
Yeah.
everything is fused. But what I can do, and I said, you're going to kind of be a little bit of an experiment for me, is I can move your neck. So your neck needs adjusting. It's not in the right alignment. So let me just move your neck and let's see how you do. All I did was adjust her neck for the first couple visits, and her low back pain went away. I never
Wow.
touched her low back, I never adjusted her low back, but because the whole spinal cord and column are connected,
Hmm.
sometimes just by realigning at the top, you can fix the rest of the back. I
Right.
I can't move her low back.
Right.
So I have to get creative, and she
Hmm.
also had knee pain as well. That went away too. So it's just a matter of people understanding, don't look at us crazy. If you tell me that you have hand and wrist pain and I adjust your shoulder,
Yep.
because that is also connected. That's a very common problem as well.
Yeah.
Carpal tunnel, things like that. I'm actually going to look at your elbow and your shoulder. I'm not going to look at that wrist,
Yeah.
because that's actually where, the problem is stemming from, because
Yeah.
everything's connected. So, yeah, absolutely.
Yeah.
Absolutely. Everything's connected.
Yeah. And I think especially, with women, we see a lot of pelvic tilt,
Yeah.
which
Yeah.
then obviously
Yep.
is not good
Nope.
because
Nope.
again, we're working down. So it's why, women are always like, my hip hurts, my knee hurts, or they're always limping or, not walking properly.
Yep.
It's
You're
all
wearing one
connected.
side out versus the other. Yep,
Right.
absolutely. I mean, I always tell people I see them on their exercise. Women tend to go forward, especially in the childbearing years, or if they have
Hmm.
bared a child, and men tend to go backwards.
Yeah.
Even if the pelvis is level, from this direction, when I look at it from a side, you're going to be tucked under. You're going to be tucked forward. That also is not going to help.
No.
You're gonna have tight muscles on the front side or tight muscles on the back side.
Hmm.
So those, yes, absolutely, and women especially. And of course, as a mom, me as well, but
Hmm.
we tend to put our health on the back burner, right?
Right.
We're getting the kids everywhere, we're doing things. I just recently had a mom come to me who was like, she's always been fit in her life, but her two grown, teenage daughters, one plays field hockey, one plays soccer. She just got caught up in all the travel ball. She lost sight
Right.
of her fitness. She gained 50 pounds. She's like, and now one's going to college and the other one's done playing field hockey. She's like, I'm getting back on track. And she had low
Yeah.
back pain. She tried to play pickleball, which
Oh,
is a common thing that's bringing people into my office too, is everyone's tried
yes.
pickleball. But she, it's like, now I need to take care of my health because I didn't do it for so many years because of my girls. So, as a mom, I understand that completely. My guy's only a little under 2.5, but
Hmm.
you have to still take care of yourself, because then you're not going to be able to do the things you want to do later in life or with your kids,
Hmm.
because you're in pain.
Right. And I think that is a very important message for all, women here, whether you are a new mom or you are a more seasoned mom with older
Hmm.
kids,
Yeah.
because, it doesn't matter what stage you are, you're still really busy with them.
Yep.
And, especially
Absolutely.
then once you do get to midlife, then now you know, might be dealing with caring
Hmm.
for not only your own children, but, older parents or older adults.
Yep.
And then you really get lost in that shuffle, but you've got to find that time. And it doesn't have to be, and I think that's the other thing, well, I just don't have the time. It doesn't have to be a lot of time, it
No.
just has to be some time.
Our adjustments, people that start that have never been adjusted always tell me like, oh, that's it. Like, that's it. An adjustment's very quick.
Yeah.
It doesn't take me long. The first appointment, second appointment, I like to educate. We obviously do the thorough exam. But
Right.
after that, an adjustment's very simple. And what you're
Hmm.
doing out, like we talked before, what you're doing outside of my office is very important as well.
Right.
So as long as we're keeping that up, you could be in and out of my office in a jiff. And that doesn't take, much. I have moms that come to me or parents that come to me right after they drop the kids off to the sitter or school or the what camp this summer or
Right.
whatever
Practice.
sport. Yeah. And then they're like, I got 5 minutes to go to the chiropractor and I got 10 more minutes before I got to pick the next kid up. So, a lot of that. I always laugh when I see my new moms. I do a lot of prenatal and I see a lot of babies as well.
Yeah.
But I see a lot of pregnant women throughout their whole pregnancy. And then as soon as they deliver, and when they come in without that newborn, I'm like, go get a coffee, sit down at the coffee shop, walk through Target by yourself. Like
Yeah.
that is, a mental stressor that you need to take care of yourself mentally too.
Yeah.
Make sure that you get that little bit of you time so you still feel like yourself. Yes, you have a newborn. Obviously, they need you a lot, but you want to make sure you're already taking a great step by making sure you get adjusted after you deliver. But let's
Yeah.
take that one step further and go across the street and just sit there and have a coffee and
Right.
do what you want to do,
Yeah.
before you go back home to that baby. So
Yeah.
those are always my favorites too.
Well, Dr. Harris, is there anything else that we may have missed that you want to touch
I
on?
don't think so. I don't think so. That was quite a bit of information for
Yeah.
everybody, but I love educating people. We love it at our office. So
Hmm.
we always take advantage when we can just educate people about what we do.
All right. And if people want to know more about you or the services that you offer, where could they find that at?
Yeah, so our practice is Worthington Optimal Wellness. It's in Worthington. If you're from the area, it's at the Linworth area in Worthington, right by 315 and 161. We have our website, worthingtonoptimalwellness.com.
Hmm.
All of our bios, there's three of physicians here, including myself. The practice has been around since 87, so it's been around for quite some time. So they can find out any information about us. If they want to contact us, there's a form there. If they want to contact just the office to ask a question, they can do that as well. We're always here for people.
Okay. And we appreciate you sharing the knowledge just on those three myths. And, that's because I think that's important because whether they
Yeah,
are local or not local, now they understand what
yeah,
chiropractic care can
absolutely.
offer to them and
Hmm.
find someone reputable within their area.
Absolutely,
Yeah.
absolutely.
Well,
Good.
thank you for joining us today. And thank you for listening to this episode of Fit News. And we will see you next time.